Welcome to our session on the Bowie Dick Test. This guide is essential for good manufacturing practice professionals to understand the test's purpose and execution in regulated environments. In good manufacturing practice regulated industries, sterilization failure is a critical patient safety issue. Steam sterilization ensures the integrity of surgical instruments and medical devices. The Bowie Dick Test is essential for verifying that autoclaves achieve the necessary steam penetration to sterilize every item effectively. The Bowie Dick Test was developed in 1963 by James H. Bowie and John Dick at the Edinburgh Royal Infirmary. It was created to identify air removal failures in pre-vacuum steam sterilizers, which were causing sterilization failures in wrapped surgical packs. The Bowie Dick Test is a daily performance qualification test for pre-vacuum steam sterilizers. It evaluates air removal and steam penetration uniformity, not sterility. Regulatory standards include European Norm International Organization for Standardization 111140/1, European Norm 285, European Norm 13260, American National Standards Institute or Association for the Advancement of Medical Instrumentation ST79, European Pharmacopoeia, and Food and Drug Administration guidance. Air removal is crucial in steam sterilization. Air acts as an insulator, hindering heat transfer. The Bowie Dick Test ensures complete air removal, allowing steam to contact surfaces at the necessary temperature. This process is vital for effective sterilization, as even small air pockets can compromise the procedure. The Bowie Dick Test pack consists of a test sheet with a chemical indicator sensitive to heat and steam, serving as the pass-fail standard. It includes a carrier made of standardized porous material, ensuring defined mass and geometry. The wrapping, either single-use or reusable, simulates a surgical pack load configuration. Test pack types include single-use disposable packs, which are pre-assembled and ideal for good manufacturing practice environments due to their reproducibility. Reusable textile packs require careful preparation with huckerback towels. Process challenge devices simulate challenging sterilization scenarios and are gaining recognition in International Organization for Standardization Standards as best practice. To perform the Bowie Dick Test, first warm up the sterilizer with an empty cycle. Place the test pack horizontally over the drain in an empty chamber. Run the Bowie Dick cycle at 134 degrees Celsius for 3.5 minutes with a pre-vacuum phase. Immediately evaluate the test sheet and document the results, including lot number and cycle details. A passing Bowie Dick Test result shows a uniform color change, indicating proper steam penetration. Any non-uniform or lighter areas signal a failure, requiring immediate investigation. The sterilizer must be taken out of service, and no loads should be processed until the issue is resolved. Ensure good manufacturing practice compliance by maintaining essential records, date and time of test, autoclave identification, cycle parameters, test pack lot number, operator details, and pass-fail results. Attach test sheets to batch records, use validated electronic systems, and apply second-person review. Retain records according to site policy, typically for over 5 years. Bowie Dick test failures are categorized into mechanical, utility, and procedural issues. Mechanical issues involve components like vacuum pumps, while utility issues relate to steam quality. Procedural errors include incorrect cycle settings. Always conduct a structured investigation, starting with a repeat test, and involve engineering, quality assurance, and maintenance teams. Avoid attributing failures to test pack variability without evidence. When a test fails, follow a structured protocol. Quarantine the unit and isolate loads first. Then investigate by repeating the test and inspecting components. Confirm results with quality assurance before release. Remediate by repairing or replacing parts and requalifying. Prioritize speed and documentation, but never skip steps under pressure. The Bowie Dick Test ensures air removal and steam penetration, performed daily for pre-vacuum sterilizers. Biological indicators confirm microbial lethality per validation schedules across all sterilizers. Chemical indicators verify cycle parameters for every load. Leak rate tests. Check vacuum integrity daily or as needed for pre-vacuum sterilizers. Parametric release relies on validated cycle data for each load in validated processes. European Union Good Manufacturing Practice. Annex 1 mandates daily Bowie Dick testing for pre-vacuum sterilizers in sterile manufacturing. Non-compliance is a critical good manufacturing practice deficiency. Food and Drug Administration inspectors examine Bowie Dick test records during process validation and routine inspections, with gaps leading to 483 observations. International Organization for Standardization, 117665 and European Norm 285 set the technical criteria for assessing test packs and results, aiding global regulatory submissions. Good manufacturing practice professionals often make critical errors in Bowie Dick testing. Common mistakes include incorrect pack placement, using loaded chambers and selecting the wrong cycle, skipping warm-up cycles, poor documentation, delayed evaluations, skipping tests on weekends, and untrained operators further compromise test validity. Each error can lead to significant compliance issues and inaccurate results. Training and competency requirements include understanding steam sterilization principles and the Bowie Dick test. Practical assessments cover pack placement, cycle selection, and documentation. Qualification requires supervisor sign-off, and annual re-qualification ensures compliance, especially after standard operating procedure or equipment changes. Perform the Bowie Dick test daily before the first production load on all pre-vacuum sterilizers. It verifies steam penetration, not product sterility. Ensure comprehensive sterilization assurance with multiple tools. Document thoroughly. If it's not recorded, it didn't happen. Apply second-person review in good manufacturing practice environments for compliance.